management there.
You're listening to Head South Radio with your host, Kat Meyer, a podcast dedicated to prioritizing pleasure and removing the stigma and shame around sex. We're here to be curious and have an open conversation about sexual health and relational wellness. This podcast is intended for educational and entertainment purposes. The information discussed is not a substitute for professional medical advice.
Hi there, this is Kat Meyer, your host for Head South Radio, and this week's episode is a little different because it's a solo quickie. Before we get started, we're just going to settle into our seat and do a quick little meditation to ground ourselves. So find a comfortable seat, root down through your sit bones to grow taller through the crown of your head. You can let your eyes close or just soften your gaze. Just giving yourself a few moments to witness your breath. Observing how you feel in your body. And then just take a moment to set an intention for yourself. And when you're ready, you can blink your eyes open. I wanted to thank all of you for listening and being a part of the Head South community. I've been getting a lot of helpful feedback, and something that's been coming up often is people wanting to hear a bit more about me and more from our guests. So we're adding Quickie episodes into the series as a way for me to touch base and update all of you on my life and the Head South world. We are also adding longer format episodes, bringing back some of our guests to dive in a little bit deeper and introducing guest co-hosts. A lot of our experts are people I've worked with through my own sexual health struggles, and one of those struggles is endometriosis. March is Endometriosis Awareness Month. Many people, including medical care providers, know very little about the condition, yet 1 in 10 menstruating humans have endometriosis. I'm pretty sure my story is similar to many of those experiencing this underdiagnosed condition. So if you don't know what endometriosis is, it's a debilitating condition which causes excessive bleeding, inflammation, and severe pain. The condition can significantly impact a person's quality of life and their ability to work, study, or engage in everyday activities. Despite the prevalence of endometriosis, effective treatment options for the condition remain limited. The awareness of endometriosis will hopefully amplify the voices of those suffering and the urgency to find non-invasive treatment solutions. I wasn't diagnosed with endometriosis until last year. So my story starts in my 20s when I had been dealing with a multitude of sexual health issues. I was having yeast infections, BV, UTI, cysts, polyps on my ovaries, PMDD, and unbearable, extremely painful, and somewhat dangerous periods. My periods were so painful sometimes that I would pass out. I'd be passing out on train platforms, in concerts. I passed out once when I was a figure model in a drawing class and I fell off the platform. And so I started developing vertigo and dizzy spells and having really intense migraines. I would find myself having to call out of work for about 2 to 3 days and cancel plans with friends because my body would feel like I had been hit by a truck. And so I'd go to my doctors and tell them all of these symptoms, all of these problems I was having. And they would often tell me that it was normal. Like it's just completely normal, which sounds kind of fucked when you're telling someone that you're passing out on a train platform from pain. And so they would often, sometimes change the dosage of my hormonal birth control. And they would also maybe prescribe antibiotics for the BV or for yeast infections. And so it was this vicious cycle and going around and around on a carousel with no solutions. And they weren't offering anything in terms of long-term health solutions, sustainable practices that could help me heal my body. And so, of course, I was getting pretty frustrated and not being heard. And this is what is known as medical gaslighting, and it's a devastatingly common experience for women, trans people, and people of color in the healthcare system. So by the time I was 28, maybe 29, I decided to go off of hormonal birth control and empower myself. And so I started by finding a primary care physician who also had a naturopathic approach to her medicine. And then from there, finding other people to join my healthcare team so we can have a holistic approach. And so at the time, I had a job that offered amazing health insurance benefits. And so I was able to see my primary care physician, a gynecologist. I was even allowed to visit Chinese medicine practitioners, dermatologists, naturopaths, a nutritionist. And this is all covered or partially covered or recognized by the insurance company. And so I realize now that that was such a privilege. It was an amazing privilege to have the access and the ability to afford seeing these type of medical care providers. And I know this now, that it is such a privilege because I do not have that job and I do not have that insurance coverage. But it took me years to build this team and build trust with these people. And knock on wood, I haven't experienced a majority of the issues that I was riddled with when I was, in my 20s and in my early 30s. One of those providers was Deb of Sage Wellness, who, if you've been listening, was our first guest on the podcast. Working with Deb empowered me to heal my body and understand it better. My healthcare journey and the ability to build that team is part of the inspiration for Head South Radio and Ask the Expert. I want to help introduce those of you listening to the amazing people doing incredible work in sexual health and relational wellness. There's so much information and resources out there being offered, but we just don't know it or have access to it. So Head South Radio is a way for people to learn about who and what is available to help empower them and make informed decisions about their bodies and their lives. That's all for now. We have some really great episodes coming up about the psychology of lingerie, menstruation education, painful sex solutions, and digital abuse. So stay tuned, and I hope you have a great week. Special thanks to all of our guests. Head South is hosted by Kat Meyer, produced by Isis Barlow, edited by Megan Hook, with music by Lily Rezi Rothman, graphics by Ella Chodos Irvine, cover art by Gina Ship Casey, and intro by Murph Meyer.
If you're looking for me, I'm heading south. All year round I'm going down. Now you know where I'll be, I'm heading south. So come on, look me